So we talk a lot about cancer being a dismal disease, but there's a very good part of cancer. 80% of cancers, if detected in stage 1 and 2, are completely curable. That means 80% of people, if they come to the doctor at the right time, they take treatment at the right time, they can go home and forget about this disease and live a normal, happy life. Also, the quality of life results in these patients is the best that there can be. Unfortunately, in stage 3 and 4, only 20% of cancers are curable. And even more unfortunately, about 70 to 80% of Indians come to the doctor or start taking treatment when they're already in stage 3 and 4. So, once we take this into account, we realize why cancer burden in India is one thing. The suffering in India is humongous because of late presentation and late start of treatment. Those cancers give you more trouble, those cancers give you more pain, and even after a painful and a prolonged treatment, the results are not as good as cancers which are detected in stage 1 and 2. So this is something that everyone needs to understand, and there's a reason for that. In addition to lack of education, in addition to lack of money that some people have, even educated, well-to-do people sometimes come to us very late. And the reason for that is, I always say the biggest disease in India is that we fear the treatment more than we fear the disease. कैंसर कैंसर तो ठीक है होता रहता है, बट कीमोथेरेपी से मुझे डर लगता है. We try and avoid taking treatments, especially treatments which are even slightly painful. And cancer treatments are, to some extent or the other, they are toxic, and we are very, very scared of those treatments. And because we are scared of that treatment, we delay going to the doctor. Even after we have gone to the doctor, we try to take shortcuts, some bhabooti, some jadi booty, some tona totka, till the pain becomes unbearable, till the disease becomes very, very difficult for us to bear. And then we go to the doctor, and then the results are not as good as they could have been in an earlier stage. And suppose I do this and I suffer and I don't get a good result, my nephew or niece who sees me will say that, see, my uncle also went for the treatment, didn't give him a lot of benefit, so there's no point of going to the doctor, and they also keep delaying their treatment. And this is a vicious circle in India. This is something that I really dearly wish people would understand more. The earlier you go to the doctor, the earlier you start treatment, and the more you go to a qualified, experienced doctor who's focused on your quality of life, the better your long term and short term outcomes, both short term and long term outcomes. Don't fear the treatment, fear the disease. Let's get rid of the disease. Let's take the short term problems of the treatment and get rid of the long term problems of the disease.